Hello, my name is Justin Peters. I'm the Assistant Medical Center Director here at Eastern Kansas. You've been selected, or you'll be soon selected, to participate in some of the administrative screening processes, whether it be at Topeka or at Leavenworth campus. I wanted to share with you a couple main points. Number one, if you're outside and you're going to be doing any Tier 3 perimeter duty, make sure you keep your social distances from the vehicles. We want you to stay at least 6 feet from the vehicles. You should be able to wear PPE, you should have a mask, you should ultimately have the option to wear your goggles and your gloves. But because of being outside and having social distancing, we just want to make sure you have a mask on in the screening role. Since the VA is not allowing any guests or visitors onto the campus, we want to make sure that everybody who comes on base has a need to come onto the campus. The reason for that is obviously so that we can keep ourselves safe, our families safe, that we can keep those that are coming onto the campus safe, our workforce, and ultimately our patients, the veterans that we serve. So we want to make sure that we stick to the script, make sure that they have a work need to be there, they need to be able to show their PIV card. Ultimately, then you ask them the symptom questions. Do you have a fever? Do you have a new worsening cough? Do you have any flu-like symptoms? If they say no to all of those, then you're going to want to ask them the COVID-19 question. The COVID-19 question is important that you ask it specifically as it's written, and I'll read it for you. So, have you been in close contact with a lab-diagnosed COVID-19 case within the last 14 days that has not already been cleared by employee health? And it's important that we ask that question. For any of the questions that are asked, if there's an employee that cannot answer no to these questions, and if they have yes because they have symptoms or they have been in contact and it's not cleared by occupational health, then they need to contact their supervisor, and that we cannot allow them to come on campus until they've been cleared. And then in closing, I just want to thank each and every one of you for what you're doing. This screening is very important. It's important to our workforce and our families and the patients, our veterans that we care for. Keep up the good work, everybody, and have a good time while you're outside in the fresh air.